Post-traumatic stress disorder, or PTSD, is a mental health condition that can develop after experiencing or witnessing a traumatic event. It can happen after a scary or dangerous event, such as a car accident, a natural disaster, or any situation where a person feels their life or the lives of others are in danger. PTSD can show up in different ways. Some people have bad dreams or flashbacks. They might feel like they are reliving the trauma. Others feel on edge all the time. They might startle easily or have trouble sleeping. It's common to feel angry, sad, or numb. PTSD, or post-traumatic stress disorder, happens because of trauma. Trauma can deeply affect a person's mental and emotional well-being. Trauma is an overwhelming event that threatens safety. It can be anything from a natural disaster, a serious accident, or even witnessing violence. It can be a one-time event, like a car crash, or something that happens over time, such as ongoing abuse or living in a war zone. When we experience trauma, our brains change. The amygdala, which processes fear, becomes overactive, while the prefrontal cortex, which helps with decision-making, can become underactive. This can make it hard to cope with stress. Everyday tasks can become overwhelming, and anxiety can become a constant companion. Paths to healing therapy for PTSD. In this section, we will explore the various therapeutic approaches available for those suffering from post-traumatic stress disorder, commonly known as PTSD. Therapy can help people with PTSD by providing a safe space to explore their feelings and experiences. It offers a structured environment where individuals can work through their trauma with the guidance of a trained professional. Talking to a therapist can help you understand and manage your symptoms. Through open dialogue, you can gain insights into your condition, learn coping strategies, and develop a plan for recovery. This process can be incredibly empowering and can lead to significant improvements in your quality of life. One type of therapy is called cognitive behavioral therapy, or CBT. CBT is a widely used approach that focuses on identifying and changing negative thought patterns and behaviors. It is particularly effective for PTSD as it helps individuals reframe their traumatic experiences and reduce the impact of their symptoms. CBT helps you change your thoughts and behaviors. By working with a therapist, you can learn to challenge and modify the distorted beliefs that contribute to your distress. This can lead to healthier thinking patterns and more adaptive behaviors, ultimately helping you regain control over your life. Another type is called eye movement desensitization and reprocessing, or EMDR. EMDR is a unique therapeutic approach that uses bilateral stimulation, such as eye movements, to help individuals process and integrate traumatic memories. EMDR uses eye movements to help you process trauma. During an EMDR session, the therapist will guide you through a series of eye movements while you recall distressing events. This process can help desensitize you to the trauma and reprocess the memories in a way that reduces their emotional charge, making them less intrusive and more manageable. Finding relief medications for PTSD. Medications can also help with PTSD symptoms. Antidepressants can help with sadness, anxiety, and sleep problems. Other medications can help with nightmares or flashbacks. It's important to talk to your doctor about the right medication for you. Never start or stop medication without talking to your doctor. Daily strategies for coping. There are things you can do every day to manage PTSD symptoms. Exercise and relaxation techniques can help. It's also important to connect with others. Talk to friends and family or join a support group. Taking care of yourself is crucial. You are not alone. A message of hope. Living with PTSD can be challenging, but you are not alone. With the right support, healing is possible. Remember to be kind to yourself and celebrate your progress. Reach out for help when you need it, and never give up hope.